Diabetes and asthma are common chronic diseases. According to the World Health Organization report, it was estimated that 420 million people had diabetes and over 339 million people suffer from asthma globally in 2016. Among these, an estimated 0.42 million and 1.6 million deaths were directly caused by the complications of asthma and diabetes respectively. Asthma is a common chronic inflammatory disease of the airway with symptoms such as wheezing, coughing, chest tightness, and shortness of breath. For patients with short-term asthma symptoms, bronchodilators can be used for relief. For patients with persistent asthma, higher doses of glucocorticoids are required. Regarding diabetes, it is a chronic disorder characterized by the raised blood glucose level resulting from insulin deficiency or insulin resistance of the body. Diabetes will increase the risk of cerebrovascular disease, heart diseases, foot gangrene, retinopathy, nephropathy, and neuropathy. For diabetes patients, medications are required to control blood glucose levels. Drugs for treating diabetes can be simply classified into oral hypoglycemic drugs and insulin injections. Currently, there is no permanent cure for diabetes and asthma. Patients can only take drugs to prevent the onset of disease and relieve the pain temporarily. At present, diabetes and asthma drugs will be quickly metabolized by the human body as the enzymes in the human body will decompose the drugs. In addition, insulin can be injected subcutaneously and cannot be administered orally. While the quick relief drug of asthma, albuterol, can be quickly absorbed into the human body, but its biological half-life is only 1.6 hours. Since there is no proper carrier to preserve the active pharmaceutical ingredients of the drug, after the drugs are being absorbed into the blood, the therapeutic effect of them quickly disappears into the body. Furthermore, there will be an increased risk of mucous membrane damage of the respiratory tissue, even osteoporosis for asthma patients with long-term use of corticosteroids. When the drug enters the body, it usually takes only a few minutes to generate the therapeutic effect. In the past, some people have successfully developed slow and controlled release long-acting dosage forms to improve drug efficacy and to reduce the toxicity and side effects. But taking albuterol, the asthma alleviating drug as an example, its dose is about 100 micrograms per inhalation, and it needs to be administered once every 4 hours and 4 times a day. This brings some inconvenience to the patient's daily life.
Lipid vesicles can enter the human body with active ingredients, but they are unstable outside the human body. So people were trying to make the lipid vesicles into proliposomes. However, the manufacturing process is difficult to control, and sometimes only a mixture of active ingredients and lipids was produced in the end. Therefore, it is difficult to encapsulate drugs effectively. The membrane of the liposome may crack or deform, and the active ingredients, especially the water-soluble ones, may separate and leak during the drying and rehydration process. Hence, our Chinese medicine research team has developed a new technology to effectively encapsulate the drug by solid lipid vesicles, which can control the release rate of drug-active substances outside and inside the human body.
Firstly, we mix active pharmaceutical ingredients, lipids, and plasticizers. Secondly, the mixture is dissolved in an organic solvent. Thirdly, the mixture solution is injected into pure water with vibration to form multilamellar vesicles. Fourthly, liposomes are formed with appropriate sizes by extrusion. Then, a protective agent is added to the liposome solution. Finally, the liposome solution is freeze-dried to obtain solid dehydrated lipid vesicles. This lipid vesicle protects and carries medicines to a certain location of the body. Then it releases the medicines at a controlled rate. This not only achieves a better drug delivery effect, but also increases the effective time and stability of the drug. Hence, the dosage, side effects, and toxicity of the drug can be reduced. If this technology is applied to the drug, for example albuterol, then its therapeutic effect can be prolonged by 4 times. Patients only need to take the drug once a day. This will greatly reduce the inconvenience in patients' lives. This technology has a comprehensive portfolio of patents in the US, Japan, China, and Hong Kong. Professor Yang's team hope to apply this technology to drugs for curing common chronic diseases like diabetes and asthma. On one hand, it improves drug efficacy. On the other hand, it reduces drug toxicity and side effects.